Hello, it's a great honor to speak with you all today about the topic, making mental health approachable for caregivers. Today you're going to hear from 3 different mental health professionals. We hope to share with you some ways to preserve mental well-being for you and your loved one. I'm going to be the first presenter today. My name is Dr. Ann Johnson, and I'm a geriatric psychiatrist here at Duke University. People often ask me, what is a geriatric psychiatrist? So I thought I would share a little bit of background with you all. After obtaining my medical degree, I completed general psychiatry training, followed by specialized fellowship training and board certification in geriatric psychiatry. With this, I've been privileged to serve older adults and care for them in the community. I treat late life depression, anxiety disorders, psychotic disorders, neurocognitive disorders, including dementias. I really enjoy my work, and I hope to share with you all today some of the things that I do. A geriatric psychiatrist might be found in a variety of settings. Just like an older adult might live at home and visit a doctor in a doctor's office, or they might be sick in a hospital, or they might be in a skilled nursing facility. Those are all the places that you might find a geriatric psychiatrist. Currently, my practice is in an office setting at a Duke Behavioral Health Clinic. So I wanted to start our discussion today by debunking the myth that depression is a normal part of getting older. Depression is not a normal consequence of aging. What are common later in life are losses. Loss of physical mobility, loss of cognitive functioning, vision, hearing impairments, loss of a career, loss of a loved one, loss of independence. Sadness and grief might be normal responses to these events. However, despite these losses, despite these vulnerabilities, as a whole, older adults have a greater sense of well-being than their younger counterparts. Older adults are wise and they are resilient. This is the reason that we want to talk a little bit more about when to become concerned about an older adult, when they might need some additional help, when they might have depression. So I'd like to talk with you all about how we might diagnose depression. So as a psychiatrist, I would be speaking with a patient, speaking with loved ones about the symptoms that they're experiencing. And we characterize depression as symptoms that they have experienced over at least a 2-week period of time. The core symptoms that we're looking out for are low, depressed mood, or anhedonia, or the loss of interest or pleasure in activities. In order for an adult to be diagnosed with clinical depression, they have to have one of those core symptoms. In addition to depressed mood and/or anhedonia, an older adult might have several other symptoms, including changes in appetite and even tremendous weight gain or weight loss. They might experience changes in sleep, sleeping too much or sleeping too little. They might have changes in their motor function, moving slowly or even moving too quickly. They might be fatigued, have loss of energy. They might have feelings of worthlessness, feelings of excessive or inappropriate guilt, the diminished ability to concentrate, or recurrent thoughts of death or suicidal ideation. If you or the person you're caring for has these symptoms and you become concerned, you might want to seek out help with your primary care doctor. So The next topic I'm going to discuss is really defining what we mean by late life depression. So late life depression is depression that occurs in adults over the age of 60. Usually, late life depression is subdivided into two different presentations. An older adult might have experienced depression earlier in life. They may be on medications. They may have been hospitalized previously. They may be seeing a psychiatrist. The other phenotype or the other presentation of late life depression is an older adult over the age of 60 who's never experienced depression before. And this actually accounts for 50% of all episodes in older adults. These are folks who have never had that experience before. They've never seen a psychiatrist, and they've probably never been on an antidepressant medication. So you might be asking yourself, how common is late life depression? And the easy, short answer is, it depends. It really depends on the population that we're sampling, and it depends on how we define depression. So if we're looking at healthy, independent, community-dwelling older adults, then the prevalence rate is 2 to 5%. And the percentage of people who have clinically significant depressive symptoms is 8 to 16%. These prevalence rates are actually significantly lower than younger adults. What is striking is that rates rise as older adults become medically unwell. So that 2 to 5% in the healthy, independent, community-dwelling older adult jumps to over 30% when you poll hospitalized older adults. And that rate continues to increase. What's pertinent right now is our older adults who have been in the ICU with COVID-19. A year later, if you ask them about depression symptoms, that prevalence rate goes up to 30%. When you're looking at patients who have had a stroke, a heart attack, or have cancer, that prevalence rate goes up to 40% and up to 50% in our older adults in the nursing homes. Late life depression can look different as people age. In older adults, it might be less common for an older adult to experience low mood, sadness, low self-esteem, or even insight, acknowledgement of their depressive symptoms. What's more common in older adults is irritability, anxiety, somatic complaints, a lot of focus on the body and how the body is responding. Anorexia, weight loss, changes in motor function, medical comorbidities, and neurologic abnormalities. Cognitive impairment can be very common in late life depression. So far, we have talked about how to diagnose and the common presentation of late life depression. When you become concerned about yourself or maybe someone you're caring for, then the next step would be to talk to a healthcare provider. There's many options of how we can manage and treat late life depression. It's person-specific. We talk with the person and their family about what they'd like to do with management, what might be most appropriate based on their symptoms and the severity of their symptoms. With all of my patients who I speak with late life depression about, I talk about lifestyle changes. This is the same as you would do with a primary care doctor when you're talking about a new diagnosis of high blood pressure, cholesterol, diabetes. You would be speaking about things you can implement into your daily routine. Regular physical exercise is a key lifestyle change for the treatment of depression. Incorporating family members is another lifestyle change, making them aware of the symptoms and the response to treatment. Pharmacotherapy is a big word to say medication management, and as a psychiatrist, this is primarily what I am doing with my patients. I'm talking with them about the indication to start an antidepressant, when that is appropriate, and which one would be most appropriate for them. We have many good options with medications, and we have options for medications that have few side effects. The next key point for late life depression management is psychotherapy, having a skilled therapist that you're meeting with regularly. Brain stimulation might be reserved for a person with very severe depressive symptoms, someone who might have suicidal thoughts, someone who might be resistant to medications, or they've tried multiple medications. Brain stimulation, including electroconvulsive therapy, is the quickest and most effective treatment for someone who has severe depression, someone who might have depression with psychotic symptoms or delusional thoughts. The other thoughts about management of late life depression include being involved with the people around you. Having meaningful relationships with family and friends. And you're going to hear a lot more about this later in our presentation. The things that you can do for yourself and the people that you care about. Thank you.
Hello, my name is Sara Emory, and I'm the Senior Clinical Director and Chief of Psychiatric Nursing for the Duke University Health System. As we introduced to you before, there are two concepts that we want to make sure you take away. We are here to help you if you need an assessment, but the work begins with you and with your loved one at home. I would like to thank you for being willing to spend time with us today to learn a few techniques that we think can help you as you work with your family member in the home. Typically, we group these and we call it distraction, engagement, and memories. If you've ever been interacting with your family member and they became anxious and irritated during an activity, this is often while you're trying to help them get dressed, while you're trying to get them to a meal, as you're trying to get everything organized to get to an appointment. As you've experienced this, when they become anxious and upset, so do you. We would like to help you think about ways that you can manage this. The first is a very simple technique that you have used many times in your life. We call it distraction. What you do is you pick something else to talk about. This allows the person to focus, but it also allows time for them to calm down and slow down. You will notice how just in that little conversation, how I slowed my speech pattern. I made it easier for you to hear what it was that I was saying. And if you notice about yourself, you start to feel more relaxed as I slow down. Common things that people can use: an animal in the yard, a color, a billboard, a TV program. Just introduce the concept to your family member of, hey, look, there's a bluebird. Remember? Don't say remember. We love watching bluebirds. Activities that are easiest to introduce for you to engage with your family member are activities that your family member enjoyed doing when they were growing up. Families have rituals. Those rituals are passed down through generations. Your family may be a family that played Scrabble. Your family may be a family that did puzzles. You may be a family that gardened. Any of those types of activities that you can build into the daily practice is going to be helpful for you and your family member. Look at how long you're doing the activity. Most adults have an attention span of about 20 minutes. As your cognition slows, your attention span becomes shorter, not longer. Plan for doing an activity for 5 to 10 minutes, then taking a break. even if the break is just taking a sip of water or having a snack. One of the mistakes that I made before, and it is a very easy mistake to make, is I said to my loved one, "You remember." They may or may not remember. If they do not remember, then they start to become anxious and tense. Really try to work on training yourself to say, the last time we saw a bluebird, they were at the bird feeder. This is the same kind of socks that you wore when you were younger. Instead of saying you remember, try to substitute this is. It sounds as if you are telling them something they did not know, but what it does is it gives them a chance to remember without feeling like they have to remember. One of the hardest things to do when caring for your loved one is making it to appointments, going to church, continuing to engage socially. There are two things we would like you to think about. Help comes in many forms, and we want to encourage you to find all the help that you can get. If your family member has Medicare, call the plan and see if they will drive you to and from doctor's appointments. While this doesn't seem like it would take a lot of load off of you, it actually does. It allows you to be focused on your loved one while someone else is doing the transportation. Any stressors you can take off yourself are going to decrease your anxiety, and that then is going to translate to your loved one. And then the final thing I want to leave you with is that isolation and limited interactions put your loved one at risk, and they put you at risk. So in the rest of this presentation, we're going to talk to you a little bit about things that you can do at home and ways that you can structure using multiple techniques just to improve the mood of you and your loved one.
Hi, I'm Dr. Christina Strayer. I'm a licensed clinical mental health counselor and supervisor, and the owner and a therapist, along with Sara Jones of Animal Assisted Therapy of the Triangle. As you can see, we work with animal co-therapists, and we also do equine facilitated psychotherapy for a variety of diagnoses. One of our passions is working with caregivers and their loved ones. We have several clinicians. I'd like to introduce Cookie. Do you want to introduce yourself? Yes? Okay. So Cookie is a rescue. He is a Chihuahua Pomeranian. And a lot of people think that what we do is that we are veterinarians or that we provide mental health for animals. And we actually provide mental health therapy for people with life transitions, but the animals are part of the process. So we have actually had people call us to help us with their birds, with depression, and we have to explain that we're here for people. So one of the things that we help a variety of clients and ourselves with, and the animals actually help us too, with stress. So we see a lot of people come in, and we have to define what is stress. Stress can be medical. It can be physical, it can be psychological, and you can have all three as well, right? So it's important to define it. One of the things, if we are overwhelmed, that we can develop, and this is for all caregivers, all types, whether you are a doctor, a nurse, a caregiver of a loved one, and I'm speaking to you personally as well as professionally. I have been a caregiver as well, which has helped me understand my clients who develop compassion fatigue. And I know a lot of people have heard about compassion fatigue, but I would like to define it a little more. And Cookie's wanting to stand up today. Okay. You have something to say too? All right. Compassion fatigue can look a lot like PTSD. You can have flashbacks. You can have activators. A lot of people say triggers, but I don't like triggers, because it doesn't make sense to untrigger. So I work with clients to deactivate with coping tools. We can feel like some of our beliefs are challenged. We can have old wounds that we have not processed be reopened. We can have nightmares. We can experience guilt, shame, rage, we can be unsuccessful at separating our professional from our personal life. I know that when I was a caregiver, I know. I think that he thinks this is a dog toy, and that's what's going on. He's looking at the fuzzy mic. It's not a toy. But so it's very important to seek professional help when you are experiencing these and more symptoms. You can begin to feel unfulfilled at work, even unsuccessful in helping. I know that I was very overwhelmed. I'm a little challenged with math, and so having to give my loved one medication was scary for me, but I reached out for help. It can be avoidance, denial, isolation. You can feel like you're zoning out, which is a form of, it is a coping form too, because the brain will disassociate when we're overwhelmed. You can feel estranged from others. A lot of people don't realize that you can become hypervigilant and you can actually begin to overwork and get in that hyperdrive mode as well. And that will affect your sleep, your appetite. You might experience panic attacks or anxiety. I experienced that myself and I had to seek help. Medically, you can begin to have high blood pressure, headaches. We mentioned the fatigue, lack of focus, lack of productivity. Anxiety, as I mentioned, the panic attacks, and this can, and as was mentioned by the doctors before, you can have irritability, poor concentration. So how do we cope with that? We can build resources. We can add resources to our life. We can reach out to the community. You can reach out to your doctors, other caregivers and groups. You can adapt your current resources. One of the things that I did was I got up a little bit earlier. I had someone stay with my loved one, and I walked my dogs more. Yes? Is that what you're ready for? Okay. You can diminish and slow down your life. Okay? Our restoration should match our stress, and I think that we forget that. Your self-talk, pay attention. Is it positive? Is it negative? It's okay to talk to other people. You'll find that more people understand than not and have had negative self-talk too. So let's talk about some of the coping. Play is very important. As you can see, that's one thing that I think Cookie's getting bored here, that animals like to do. And that's one of the things that we do incorporate. We will incorporate play and even different animals. As I mentioned, we incorporate other animals to work with us too. So this is Prince. This is my dove. And Prince, as you can see, opens up the concept of talking about bringing peace into our lives. And Prince will react. Often clients might come in and are stressed. And as you can see, I'm kind of rocking back and forth, which is bilateral stimulation. And that relaxes us. And if my energy is too high, Prince would match that energy. So right now, she's happy and calm, and she may even go to sleep here. So we mentioned play. So Prince will fly around the room as well, and we can incorporate that. We also exercise. Okay, so Prince, I'll release her. She'll flap her wings. You don't want to keep a bird in a cage for too long. And so we talk about, taking a break from your loved one when you need to, or from your job. And it can just be a simple 5-minute walk around the block. Music is important. Oftentimes, and my children can tell you, one of my breaks, and they will be speaking to their therapist about this probably, is I will come home and put 80s music on and just dance around and just have a transition from work. So it's important to have a transition in your life. Another form of exercise is Tai Chi. Tai Chi in yoga can relax the nervous system. Again, it's important to match your restoration to your stress. Journaling can help. Journaling is cathartic. Evidence shows that it works almost as well as talking what's going on for you and your problems out. And it doesn't have to be, it's not like English 101. It can be art journaling, it can be drawing, coloring. Coloring, especially with crayons, smelling the crayons, brings us back to a primal sense of being a child, and it relaxes the nervous system. So even taking a coloring book to doctor's appointments with you. Pets, as I've shown you today. Having a pet, as long as it's not a stressor, or even playing with someone else's pet, can reduce your cortisol, increase your oxytocin, and relax the nervous system. I'd like to teach you a progressive muscle relaxation, which is another coping tool. And I'll teach this very briefly. And as I tell clients, always make interventions your own, okay? So I like to say, and I'm sorry, to take a deep dog breath. If you've ever seen a dog circle around, and then before it lays down, it will inhale, and it will blow the breath out. And they do that to relieve and release any tension before they lay down. So that's a simple, easy thing you can do, but be careful because spouses and parents think you're huffing at them. Okay, so let them know what you're doing. A nice deep, okay. All right, so what I'm gonna ask you to do, you always wanna make sure before you do this that you're not in pain or hurting anywhere, but you're simply going to tense muscles and beginning with your feet, just kind of take your feet and just tense them up and then release. And progressively, you then go to your calves, your upper legs, nice and slow. And you're just tensing. That's funny. And releasing. Okay? And then your back, your arms, and so on. Your neck, your face. Okay? Prince is laughing because I just began to go back to the gym, and he's like, you don't have muscles. Thanks. All right. Guided imagery. The body believes whatever the mind tells it. So if you have a memory or a loved one has a memory that calms them, you can bring that image to mind. Okay. So this is my new therapy dog in training, Sati. And I take Sati to the beach every day. And that is just the sound of the ocean is a natural relaxer. It might be the mountains. It might be just a favorite item. It can be anything. Social sharing, when we share our problems, okay, we're also, again, that works at like talk therapy, and it takes the pressure off. Where are we going? You want to fly? Okay, I'm almost done. Some more coping tools are accepting where you are at the moment versus resisting. Having confidence. Staying physically fit. Speaking your truth to others. And seeking therapy. It's important to step back when you can and try to create balance where you can in your life. That can also be a resource, whether it's your spirituality, it's your physical health, your mental health, your financial health, work, your purpose in life. Don't forget to put yourself in the equation as well. So I often ask clients during therapy, what is your safety net? To choose your habits wisely. If we cope in negative ways, it may be a temporary release, but long-term, that's not going to help you. So in conclusion, there are bumps ahead, but remember that the best things in life are free. Hugs, family, love, sleep, smiling. Thank you for listening to us today and meeting the animals.